So I am doing my presentation on a nurse versus a general practitioner. Your career path as a nurse or doctor will play a huge role in your personal life, health, and place in society. Choosing a career is one of the most important decisions you'll ever be forced to make. There are many things to look at before ultimately choosing an education and career, such as education requirements and costs, the salary you expect to earn with each career, the daily role you will play in your career, and the effect your profession will have in your personal and social life, and also your health. Failure to make the right decision could result in wasted time and money, or worst of all, waking up every day and going to a job that you do not enjoy. So the education requirements alone are enough for some people to determine their career. To become a nurse, you have three choices. You can earn a diploma from a hospital-ran program, which usually takes 3 years to complete. You can earn an associate's degree, which can be done at a local community college. That takes 2 to 3 years. Or you can earn a Bachelor of Science in Nursing, which takes 4 years. Advanced practice nurses, such as a nurse practitioner, must have a bachelor and master's degree, which takes a total of 6 years. So to become a doctor, you must earn a bachelor's degree before entry into medical school, which is 4 years. And in most cases, you must earn more than average GPA and MCAT scores. Medical school is 4 years, and then you must enter a residency training program, which normally takes 3 to 7 years, depending on your specialty. If you are certain of your medicine, your interest in medicine, there are combined BA and MD programs that could possibly eliminate a year off your training. So the cost for education isn't as nearly as important as some of the other factors, but it's definitely something to look at. An associate's degree for nursing, usually in-state, is about $4,000. A bachelor would be anywhere from $20,000 to $27,000, and a master $10,000 to $30,000. For a doctor, your undergraduate program usually is around $12,000, and medical school can range from $49,000 to $66,000. You do get paid in residency, although you will be repaying loans. So salary, the yearly average salary for a nurse is somewhere between $40,000 to $80,000, depending on your level of education. And for a doctor, between $70,000 to $200,000. As a nurse, you would hold your place in society as a middle-class citizen with a weed-class consensuousness. Middle class usually lacks the ability to use power and social ties for groups and control in society. As a doctor and a member of the upper class, you would hold a high class consensuousness, or ability to assert power through social ties and social groups in society. So the role differences, to me, are one of the most important determining factors when choosing a career path. As a nurse, you will have more routinization, where you will lack the ability to problem solve, use creativity, make your own judgment. There will be higher ritualism, where you must follow the doctor's rules and orders. As a doctor, of course, it would be much less routinization. You would have the ability to use critical thinking, problem-solving skills, and creativity. As a doctor, you would take on the leader role with less ritualism, and you would be responsible for guiding the healthcare team and patients. So it's important to ask yourself, is this my nature? Will I enjoy being a leader or follower? Is it natural to me? Or is it something I could possibly adapt to? So your personal life will also be affected in many ways. As a nurse, you will have much less role conflict and responsibility, and as a doctor, much more role conflict and responsibility. Many doctors are required to be on call overnight, or if you ran your own practice, it would be much more difficult to take a leave of absence. This could interfere with your option to, stay at home with your children if you desire for a period of time. As a nurse, you and your family would have weaker life chances than a doctor who would have higher life chances, such as living in a safer neighborhood, a better school district for your children. So it's important to determine whether you'll be able to afford private schools and colleges, or whether that's of importance to you. Your social life will also be greatly affected by your occupation. Your occupation will determine your role in society, such as your social networks, in and out groups of which you belong to, your social mobility, and status quo in society. Occupational prestige scale measures how much society places importance and worth on an occupation. So with people such as doctors, of course, being at the top, mechanics, servers at the bottom. As a nurse, you'll be more towards the lower end of the scale, and then as a doctor on the very high end of the scale. Your socioeconomic status, or your combination of occupational prestige, income, and education in society, would also be much lower as a nurse and higher as a doctor. So your health would also be affected. It's actually proven that the more education you have, the less likely you are to die of stroke, heart attack, etc. And a study found by DoctorCHRISTYIHDE also showed that people in the most affluent groups in society are expected to live 2.8 years longer than people in the most deprived. Before choosing a career path, it's critical to evaluate how the occupation will affect your life in all areas.